Good afternoon and good morning, everybody. Welcome to what is the second in our thematic innovation ecosystems for Skills for Health. My name's Andy Bleeden and I work for the European Connected Health Alliance. I'm very pleased to open this of our second event and hand over to my colleague in Melbourne, Susan Feitosa from RMIT. Susan, over to you.
Thank you, Andy. As is the custom of Australia, before gatherings and events, we offer an acknowledgement of country. So as we gather virtually from all areas around Victoria and beyond, we acknowledge the people of the Woi Wurrung and the Bu Wurrung language groups of the Eastern Kulin Nation, on whose unceded lands we conduct the business of the university. RMIT University respectfully acknowledges their ancestors and elders, past and present. RMIT also acknowledges the traditional custodians and their ancestors of the lands and waters across Australia where we conduct our business. Thank you, and now over to you, Andy.
Thank you very much for that, Susan. Okay, welcome all of you to this event. Just a few housekeeping rules so we get the most out of this event. Obviously, first up, you'll all have seen a notice saying this event's been recorded. If you don't like that, please mute your microphone and remove your camera, then no one will know you're here. Please also turn off your cameras and mute your microphones during all the presentations. I'll be looking for questions through our breakout function later on, and then we'll ask you to unmute your microphones and turn your cameras on if you want to. But when you come back into the main room, please mute your microphone as you gradually walk around your house or engage with other work. Also, it helps us be able to concentrate on events today. Okay, thank you for that. So let's kick off. We'll go to the next slide. My name's Andy Bleeden. I work for the European Connected Health Alliance. Just a little bit of information about who we are. We're a member organisation. We're the global connector, and today is a fantastic opportunity to showcase that as we bring together our Australian and our Danish ecosystems, plus many of our other ecosystems across the globe. We're a member organisation with about 850 odd organisations, most of which are public, not-for-profit bodies, and about a network of about 20,000 people. Join us and start getting involved and start getting connected. How you do that, I'll show you in a moment. But we, as I said, are the global health connector. We connect up those groups, those people, those individuals as a not-for-profit using a series of ecosystems. People join us, go for the next slide, please, for the following reasons. Usually to promote their organisation, but like today, to access our ecosystems. So join us if you're a not-for-profit or public body, or government organisation. It's free, so it's a great opportunity. They also join us for a number of other reasons, whether it's to do with funding, joining working groups, speaking slots, etc. The classic things you get from a member organisation. Let's go to the next slide, please. I talked about ecosystems just now. People have a different understanding about what ecosystems are. I see them as a great way to match both need and solution in health. Our ecosystems are permanent multi-stakeholder gatherings, bringing all the stakeholders together in health that you'll see in front of you now. What they do is break down silos, because they exist now even more than they did when they set up in healthcare 30 years ago. People don't talk and listen to each other. They also transform healthcare. And vitally, they're around creating economic growth. Let's see where they are on the next slide. We've got a group of ecosystems, a network that's grown exponentially in the last couple of years because of the pandemic. We've just opened our 70th in Japan, which is fantastic. I joined the first ecosystem, and I joined because I wanted to get involved and get connected with other people involved in health and social care. You can see some of those ecosystems on the map here. And today we're going to hear from two great examples from both Melbourne and South Denmark, who actually run this thematic ecosystem. So let's look at what a thematic ecosystem is. These are exactly the same as our geographic ecosystems, but they've got a thematic run to them. So we're looking at a variety of different themes, where be it health procurement or digital health and wellbeing, or on the issue of skills. Because we hear a lot in the last year and a half about how digital health innovation has led to the realization that we need to improve our digital health skills. That's what this ecosystem's about. I'm going to shut up now and hand over to people who actually know about digital health skills in Australia with Karen Butler Henderson, and in South Denmark with Caroline Strudwick from the South Danish ecosystem. Over to you. Thank you very much.
Thank you, Andy. Thank you. We sent out, before this event, we sent out a survey to try and get a feel of what the state of skills for health is in the members of the ECH Alliance. And I'm happy to say that we got 32 answers to our survey. So thank you very much for that. And these answers represent 17 different countries. So this is a good view of what it's like today. Next slide, please. So one of the questions we asked is what is the need for digital skills for different target groups? So for example, for citizens and carers and so on. There's a little bit of difference, but it's very high. We rate the need for skills, for digital skills, very high for all target groups, especially citizens and carers and digital health specialists. Next slide. We also asked you to give us answers to what are the main digital skills gaps that you see today? And you can see some words here on the screen that represent the words that were put into the survey. The ones that are in larger letters are the ones that came through several times. So for example, communication, training, management, tech support, implementation, infrastructure. So very, very different digital skill gaps were represented there. Next slide. We also asked you to, how did you identify the gaps? And you can see that a lot of people identified them through experience. Some people did surveys, and also from other investigations and so on. And some didn't investigate it. So there's a big difference on how we figure out what the gaps are and what the skill needs are before we develop the skills. Yeah, next slide. We also asked you for top three activities that you do within digital skills development in your ecosystems. And there were a lot of answers here, so this only represents some of it. But of course, there are different educational programs, free training, for example. Also, there's a lot of focus on multidisciplinary collaborations and piloting different solutions, or national, national activities or national strategies. So very different approaches to improving digital skills. Next slide. But what is then the most successful strategy? And I think it's interesting here that there are very different ones. Some of them are a little bit connected or related, but we can see that different countries or different ecosystems use different approaches and have successes with different approaches. So there should be some basis for sharing knowledge and experience here. But some of the ones I want to point out are, for example, piloting and strategies and long-term strategies. And the critical success factors as well, you had a choice there to note down. And available tools, resources and training, and building awareness were some of the ones that really stood out, that these are critical success factors for bringing up our digital skills. But also it's relevant to mention leadership, motivation, time, and available technology. But also we got some more input from you on other things to consider. They're represented on the right here. And again, they represent some of the words that we also saw earlier. So we're looking also at infrastructure, we're looking at common goals, we're looking at general tech readiness and that kind of thing. So these are some of the results that we saw. And let me just make sure that this is the last slide, right? So I will bring it back to Karen, because some of the ecosystems also provided some presentations on how they approach digital skills now. So over to you, Karen.
Thanks very much, Caroline. So we invited the ecosystems to also answer 4 questions for us about how are they in their ecosystems addressing the skills for health. We had responses from 5 ecosystems, and we'll be sharing the detailed responses of each ecosystem with further information that comes out of today's presentations and workshop. We'll share that with everyone later on, but I'm just going to summarize a few key things. So as you can see in front of you, the skills gaps reflected what Caroline just presented in the survey results, that a lot of ecosystems have identified that within their area, the gaps are across literacy, awareness. So what technology to use, how to use the technology, how to make the best use of it. Digital concierge, so having people who are experts in the technology being able to help citizens or health professionals to be able to use that technology. There's a lot of resistance to the use of technology. There's a need for training, and there's a need for specialized workforces in information technology, artificial intelligence, and data analytics. So it reflected very similar to that survey result. Another key thing on the next slide that you'll see is we also had a look at what are those future trends, because this is going to inform us where we need to develop the skills in health. You can see the 9 areas that came from these 5 ecosystems related across artificial intelligence, data integration, technology to be able to prevent disease, technology to drive new models of care or to support new models of care, the use of different types of innovations for personalized care, robotics, technology for self-diagnosis, self-monitoring, and also service digitalization. But the question that we didn't ask and that we really want to explore today is, how do you identify what are those skill gaps? So I'm going to hand back to Caroline, who's going to introduce our first speaker for tonight.
Thank you, Karen. Yeah, so also what I found in the survey was that there's a big difference on how we actually determine the skill need. So today we've brought Randi Lehmann-Bosen to tell us a bit about how to investigate and determine digital skill needs and how to assess skill needs. And so Randi is an anthropologist, and she's worked within this field for 10 years in the healthcare sector on innovation projects. And she focuses a lot on the needs and understanding the people. So she will give you some reflections and good advice and what to be aware of when you're working with training digital skills. So welcome, Randi, in the same room as me.
Hello, good morning or good evening, depending on where you are in the world. Thank you very much for inviting me to speak in this session. It's really exciting to be speaking to people from all over the world, sharing experiences that we've been doing here in Denmark and in our region. Yes, so I'm going to dig in, as Caroline told, in how do we actually investigate on the needs that healthcare professionals and patients have in relation to digital skills. How do we do that? And what does it take to make training courses that actually work in their practical everyday life and that makes them use digital technologies? Yeah, so I'll give you some good advice from our experiences and go through some cases I've been working with. Could you shift? Thank you. All right. Before I'll be starting with telling you about a case we've been working with. As in many of your countries, there's a lot of focus on digital strategies, on digitalization in Denmark. Actually, we have a goal of around 30% video consultations in many of our hospitals. So that is quite a lot, and much more than many are actually doing at the moment. Everything is recorded digitally. There are health apps for patients where they can monitor their healthcare data. They can chat with healthcare professionals, have video consultations. So a lot is going on in Denmark, in this region, where both patients and practitioners have to change their practice, do things very differently. And the region and Denmark has really taken up this challenge, and a lot of funding has been put into this area. So everybody wants to start doing projects to find out what actually works. And as a health innovation center, we have been digging into many of these projects. And one of the projects we've been doing is a project called Become Digitally Competent. We received funding for a project where we collaborated with University College here in our region, and we did investigations on, all right, which digital skills do you actually need when you work in a hospital or in a municipality? Which kind of training course makes sense in your everyday life where you are very busy with patients? And well, we talked to a lot of healthcare professionals, did interviews, meetings, and then we designed a training program for 3 days with a lot of physical attendance and a lot of talks. And it was a great success. We were so happy because everybody was glad, nice evaluations. And we thought, great. So now we have something that we can spread out to the rest of the hospitals. And actually, unfortunately, we really failed. We really failed in just taking this concept that was so well prepared. You know, we actually did it 3 times. So 3 times, 3 full days of training and then evaluation. And it just didn't match what the hospitals needed. They were not really interested in these 3 days that we'd made so neatly. And why did we fail? Well, actually, one of the hospitals said, please help us make a training program that fits our needs. And we thought, all right, then we have to do a local need analysis in your practice. So we did. We dug into what the practitioners actually needed in that specific ward where we wanted to make a pilot. We asked the doctors, the nurses, and the secretaries, because actually we found out the secretaries, they were suddenly the ICT supporters, unofficial ICT supporters. So things were going on that the hospital didn't even know about. And we also tried to find out in all these other hospitals what's actually going on, and we joined all this research, all this knowledge on what actually works. And the learnings from many of these, all these need analysis is here on the screen. Digital technology is just not top of mind of many of these healthcare professionals. Nursing is, treatment is, caring about the patient, that's what's top of mind. Digital solutions just have to support all this. So if we don't focus on the digital skills and the digital solutions that they have to use in their daily practice, it's really hard to find motivation among these professionals. And so they have to see meaning. It has to be meaningful. So once you have people who find good solutions, for example, video consultation with relatives who maybe live in another city. And once you have some practitioners who start using that and find out, wow, this is smart, and these relatives, they're so grateful because they can participate in this consultation together with their ill mother. This creates good stories, and once these stories start to spread, then we have some success. Then people start getting motivated. Yeah. Next. Yeah. What we found out was a big problem was that many of the solutions are maybe not that easy as using an iPad. You know, my 2-year-old, she could use an iPad. Many of the technologies that the healthcare professionals have to use need a little more training. And when you're a really, really good nurse or really good doctor, it can be stressful that suddenly you have a technology between you and the patient that you don't, that you actually don't know that well, and it can fail, and you can seem really unprofessional. and you can feel incompetent. So this fear of feeling insufficient as a practitioner, maybe you have 10 years experience, was one of the big gaps we found, one of the big fears. Yeah, next. So yeah, it just has to work. So what we found out, what really worked in order to make people use this in practice, was that there is easy access to support where you need it and when you need it. So we had to have these sort of super users or experts who can help, as also it was mentioned from the survey you mentioned earlier on. But having these local ICT experts didn't have to be that much experts, but people who can help the colleague startup, that was absolutely essential. And having them close to the practitioners so they could step in when there was a need, very essential. Yeah. And then if the management is not involved, if there's not leadership, if there's not a strategy and a will, then it's really hard to implement. Yeah, so ownership among the managers was just essential for it to be a success. All right, and last but not least, of course, access to good, solid equipment that works. All right, so these were the learnings. So what did we actually learn from doing all these investigations? Could you shift? Yeah, well, we found out we cannot just take a one program and then just say plug and play in another setting. We have to do local research. It's essential that we find out what's actually at stake in this local place where someone has to use another technology, do something very differently. What are their needs? What is their motivation? And what is their mindset when it comes to technology? Where do we have to start here? And also, we found out that the organizational factors are just essential. Is there management support? How is the ICT support system? Is there collaboration between the ones who sort of who are responsible for the healthcare staff and their timetables, and the ones who want to provide training? How do they collaborate? And then at least but not last but not least, we need to know which level of digital competence are these people on. This was a need that we especially had to dig in when we made another program where we we are actually in the middle of that project, which is an European Erasmus Plus project, where we are in a group trying to share the knowledge from become digitally competent and the rest of the things we're doing in a European setting. So here we want to spread these learnings and these training activities we're making in Denmark, spread them across Europe, and of course learn from each other from these different partner countries. So how do we find out at which level the healthcare professionals are in all these different countries? Where do we start? So now I'll be talking a bit about some of the methods that we've been using. First, for understanding the needs, mindset, the organizational factors. Well, I'm an anthropologist, so I think it's really, really important, and due to my experience, I think it's really important that you actually speak to people. Talk to people, find out what is at stake, do interviews, just talk with them, ask what's important for you, which solution do you want to use, what is the problem, why is it hard for you? You can also do focus groups and observation, try to see what is it people don't understand, how do they actually use the program. We also tried to find out what do they contact their ICT supporters about, to find out which are the most common questions. But I would really, really recommend that you speak to people, find out what's at stake. And then, of course, to find out the level of digital competencies. Next. There are some really good tools to find out where are people when it comes to digital skills. So first of all here, I've put digital or framework on digital skills in the middle, because you have to find out what are the digital skills that we're looking for actually. And then to find out at what level people are, you can either ask them from on a scale from 1 to 5, how good are you at downloading an image? Or you can put them in a room and you can set them in front of the computer and you can say, try to download an image and then see if they can do it. So there is self-efficacy assessment, or there is sort of performance or knowledge-based assessment. Well, depending on how much funding you have in your project. Of course, it's easiest just to ask people to do self-rating. So on digital frameworks, if you could go to the next, please. We have been very inspired by using the DIGCOM 2.0, which is a European digital competence framework, which outlines 5 areas of digital competencies and then 21 specific competence areas, which are information and data literacy, communication and collaboration, as you also said in the survey, digital content creation, safety and problem solvement. This framework is really good as a general framework, but it's not specific for professionals. To use a digital framework, skills framework that is more specific to professionals, we found actually a Danish framework called Digital Competence Wheel, which is developed specifically not for healthcare professionals, but for professionals within, in the Danish public sector. But it's also quite good for just generally for looking at digital health skills among healthcare professionals. Yeah, next. In my last slides, I'd just like to share a few tools with you. Maybe you know them already, maybe you don't. It took us quite some time to find these, so now I'll just be sharing them with you. A good tool to do self-efficacy assessment on eHealth literacy was the digital competence wheel, where you can go and digitally go through some questions and then get rated on your competence level on different areas. There's also the skill knowledge. Yeah, here is an example of it. You can see in the end, you're rated in a wheel where you can see where am I weak and where am I strong. If you could go back, please. Yeah, then there is a SCAD framework. There's a Spanish Grupo Menarini made of a questionnaire, online questionnaire. And in our Erasmus Plus delivery project that I was talking about, we have developed our own questionnaire, a digital survey based on these questionnaires above. So I would recommend that you dig into these if you need to do a large scale assessment of digital skills. Next. Next again. Thank you. For knowledge and performance-based assessment tools on eHealth literacy, this is not something we have done in these projects, but if you have a larger group, it could be a good idea to find some inspiration in, for example, the French PICS, where you can actually assess digital skills, and there are also some tools, some e-learning tools where you can practice them yourself. It's actually a really fine tool. And then we know our good companions in our project, Catalonia. They are doing an Arctic project where they're actually upskilling all their healthcare professionals in that region. And they are working on some really interesting things. So you might want to hook up with them if you need experience on that. So those were the tools I would like to present to you and our experiences. If you could go to next. Here you see just a brief example of PICS. Next again. Yeah, so my final word is please just dig in. Use some of these methods and be curious. Please be curious on the local needs, otherwise you won't success. Thank you very much. I'll give the word to Caroline.
Thank you. Thanks. Thank you for telling us a little bit about how to determine digital skills. Now we're gonna, as Karen earlier also said, we're going to look into some of the innovations that are shaping healthcare and digital healthcare in the future, and how that will affect the digital skills that are needed for our healthcare staff, our citizens, and all the different target groups. So I've brought with me today Christopher Møller Jensen, who will present to you one of an innovative solution for rehabilitation that can affect the digital skills level needed for different target groups. So welcome, Christopher.
Thank you. Yes. Thank you so much for having me, and thank you, Caroline. Yeah, and I will tell about Rehab DK. I will start out to say that Rehab DK is not rocket science. However, it is a solution that seeks to overcome some of the challenges that we face today with our analog rehabilitation solutions. The solution is an exercise-based app for the patients and a web-based solution for the therapist. Healthcare professional can then create and distribute an individual digital rehabilitation program that guide patient through rehabilitation training, as well as provide valuable data to provide to the benefit of the patient and the therapists. The solution is publicly owned and are primarily funded by the region of Southern Denmark and the municipalities, and some of the development of the app and the web-based solution is supported by various funds and research. And if we are looking at how Rehab DK is seeking and using a user-centered approach, we are always trying to look how we can implement the patient and the therapist in the center of our project. This will I come into later on, but our mission is to improve quality of care in the healthcare sector, and to ensure empowerment and encourage patients to take responsibility and engage more actively in their rehabilitation. For example, can the patient see training data and move up in sensitivity or progression themselves? Further, we are seeking to create transparency between sectors. So the primary and the secondary care it's possible for the rehab training program to follow the patient through different sectors. This means that if a patient are in the hospital and move out to the municipalities, then the training program and all the information for the patient can move from the hospital to the municipalities or the therapists. Next slide, please. Yeah, and this is what we are working when we are talking about a user-centered approach. We invite patients and therapists to workshops where we discuss new functions, we discuss new features, we are discussing what are the needs and skills that both the patient and the therapist need. This are we doing to ensure that we don't implement new functions that can be used in practice. Next slide. Yes. Rehab DK is already in use in several of the municipalities, but we are now working to spread it out to all the hospitals in the region. And in our implementation experience, we found that video recording with the local therapist, as we can see on these two pictures up here, is important, because that secure ownership in the implementation phase, and having local ambassadors to promote the digital solution is vital. Next slide, please. Yes. You can, yes, thank you very much. So when we need to discuss, in this case, what are the building blocks of Rehab DK, then we have an app There's for the patient can only go to Rehab DK through the app. And then we have the web-based solution for the therapists. In the app, the patient can see exercise videos. The exercise videos are performed by a professional therapist. The patient can communicate with the therapist through the app. They can see statistics, and they can get notification. As we are spreading out to the hospital, it is also possible for the patient to move to a more centralized app within the hospitals, where the patient can see booking or appointment with, for example, the surgeon or other healthcare professionals. So these two apps are linked together to make it more user-friendly for the patient. Then we have the videos, the central meaning of Rehab DK. We have more than 750 videos, all in high quality and with both verbal and visual instructed. And if we are moving to the therapist-based side, the therapist can make individual training programs and send them out digital. They can see statistics of how have the patient done their training, what was the level of pain, and what was the compliance. They can also see comments from the patient. The patient have the opportunity to comment on one exercise or the whole training program. And they can make, and it is possible for the therapist to make research project if necessary. This means that they can send out surveys to the patient through the secure system to the patient and the app and collect data. Furthermore, the patient can share standardized training programs between each other internally and across department and sectors. So it is possible for the therapist to send out some well-funded or well-documented rehabilitation programs from the municipalities, for example, to the hospitals, if they can agree on that part. So Rehab DK is on these building blocks, and if we go to next slide, yeah, you can tap 3 times on this one. Yes, one more. Thank you. One back. Yeah, exactly. In the first picture, we get a peek of how the patient are moving in within the Rehab DK. Here, the patient have the opportunity to see the pain icon is marked with the red circle. The level of pain is this pointing in the middle, and the compliance, the green one on the right corner. That's a sneak peek of how the patients see it, but one of the things that we are trying to improve is the quality of care. And if we go back to the missions that I told you on later on, we meant that improved quality of care is being able to remotely monitoring changes in level of pain, and also being able to remotely monitor exercise compliance, and not limited by exercise illustrated in a leaflet, but being able to design tailor-made, in the right corner, tailor-made programs matching the fitness level of the citizen or patient. For each exercise level, 3 levels of intensity or progression can be added on to the patient's training program, to give the patient more responsibility, because they can make themselves move up a level in intensity or progression. That is in the right corner. You can see the 3 exercises. The first one we can call level 1, the next one level 2, and the third one level 3. And the patient have the opportunity to move up a level if they feel so, but the therapist must agree with this option beforehand. And to the next slide. Yes. So what is the next step? And what are some of the skills that we are seeking that the therapist and the patient can do in the future. In this month, in last September, we will launch a new function where the therapist can record the patient and with the mobile phone or with the tablet, and that recording can drop in or be put in the training program and support some of the other exercises that's already in the training rehab training program. And it will be a major improvement of the patient's individual training program, because the therapists are sometimes recording with the patient's phone and give the leaflet with them back home. But here we can, in a secure system, take the video that the therapist have of the patient and drop it in with already existing training digital training program. And the next step we are looking further into is real-time tracking, where we can track real-time how the patient are moving, or accurate tracking of the training. This will provide a lot of data for the therapist, but we are seeing this kind of data, for example, the real-time tracking, the level of pain, the compliance, as a opportunity for the therapist to talk with the patient in the consultation about some of the issues or some of the things that we need to be aware of. So it is not to point finger at the patient, but more as a tool for the therapist to use in the consultation with the patient. Yeah. And this last slide. That was all I got. That was a case of Rehab DK and what we are working on, and some of the tools that we are using for our patient and for our therapists. We have the app for the patient and the website-based function for the therapist. So yeah, that was all I got.
Thank you very much, Christopher. I'd now like to introduce Cameron van den Dungen and Smeet Wally. Cameron is the CEO of Sleeptight and a non-executive director of 40 Winks. For more than a decade, Cameron has travelled the world searching for innovation and technology in the space of sleep science and research. The basis for the search was to determine what was next for the sleep industry and how the bedroom would evolve as part of the connected home. Cameron uncovered gaps in the quality of data collected by existing sensors, as well as the lack of research and understanding around how to measure a good night's sleep. This led Cameron to create Sleeptight, a health tech company designed to innovate in the space of health and sleep, with a focus on creating world-leading products for the connected bedroom of the future, whether it be in the home, the hospital, prison, barracks, or even the boarding school. In July 2018, Sleeptight, along with project partners RMIT University and Sleepy's Bedding Australia, received a Cooperative Research Centre project, or a CRCP grant, from the Australian Federal Government to be able to develop a non-invasive aged care resident nighttime monitoring and alert system named REMI, which both Cameron and Smeet are going to be presenting today. Sleeptight has also designed and developed and commercialised innovative adjustable beds, mattresses, and other sleep-related products. Dr. Smeet Wally is the Associate Professor in the School of Engineering in the STEM College at RMIT University. His research in materials synthetics, micro and nanoelectronics and sensors has resulted in the creation of breakthrough technologies that are transforming healthcare and creating futuristic autonomous systems. His research has created a holistic impact through industry partnerships and translation. At the same time, Smeet has ensured equity, diversity, and inclusion in the STEM sector through advocacy at a national scale. He co-chairs the Science and Technology Australia's Equity, Diversity and Inclusion Committee, an organisation that represents the interests of 80,000 strong STEM workforce in Australia. With over 80 publications in top journals, 8 patents and notable awards, it has created an ecosystem of innovation-driven impact with tangible outcomes. Featured extensively in national and international media, his research has been underpinned by strong multidisciplinary partnerships across traditionally isolated expertise. We also congratulate Cameron and Sumit for their recent win of the Knowledge Commercialisation Australasia Limited Award for the Best Industry Collaboration and the People's Choice Award for the amazing REMI system innovation. Welcome, Cameron.
Thank you very much. And that was a lovely welcome. I sound far more impressive than I feel. I can be honest with you in that. Thank you, everybody, for listening today to our little story and case study about a product that's been near and dear to my heart for a very long time. I'm Cameron Vanderdungen, and I'm the CEO of Sleep Tight. Sumit will join me partway through this. I'm going to bring you the first part of this presentation and tell you the story to REMI, and then the rock stars of research at RMIT will bring it home with just how they innovated. So if we flick across to the next slide, one of the most important parts of this project for us at Sleep Tight is the why. Why do we exist, and why should anyone care? And our why is very clear to us as a team, and that is to increase the health and well-being of all older Australians. As this program has grown, we're looking beyond the Australian borders, but very much that why was to put dignity and respect back into the lives of those that live in either our residential aged care facilities or even our retirement villages, or living in an aging in place model. To give you an idea of the Australian market, we'll flick over to the next slide. We've just in Australia recently had a Royal Commission into aged care quality and safety. Now, for those of us that have been working in and around the sector, many of the findings, and I have both the interim findings and the final report sitting on my desk every day as a reminder of the tsunami of challenges coming our way for this sector and that have been growing. Now, just to give you a bit of an insight in the Australian numbers, the number of people aged 85 and over in Australia is projected to increase from 2% of the population in 2018 to 3.7% in 2058. So that's a rise from 500,000 to 1.5 million. Now, that is going to bring some massive challenges for this sector in Australia. It's something that's very similar that we're seeing throughout Asia, throughout Europe and North America as well. Now, one of the challenges we see is the care workforce, that they are under massive pressure as it is. And as we grow, as we increase the numbers of people that require further assistance, we need to make sure we give them the tools. That's the carers, the care workforce, the nurses, the registered nurses, the occupational therapists, and people on the front line, all the tools to be able to do their job effectively and efficiently. So when we think of users, we don't often think of the elderly as the end user. We actually think of the carer and the care workforce as the user of REMI. And that'll lead to what do we do? So if we flick over to the next slide, it will give you a bit of an idea of what it is that we actually do. Now, you heard in the introduction, we innovate and develop technology and products in and around the bedroom. Now, we've looked at lots of different bedrooms in the connected home, but our focus, and we're very clear on this, as I mentioned in our why, is to innovate in the aged care bedroom, both in the residential aged care facilities and also with an aging in place or a home care model, as we refer to it in Australia. Now, REMI is the product I'll talk to you about today, and this is a nice little visual explainer. The current standard of care in Australia, we'll go back to that last slide before I come over to the video. So if we just flick back to that last one, the current standard of care is a nighttime door check, where a carer every hour on the hour will go through the facility and check each room. Some rooms have crash mats, some have sensor pads. In Australia, invasion of privacy is a huge concern, so we don't use cameras and we don't use microphones to monitor. In Asia, that's slightly different, and Europe obviously has its own standards in the various countries associated with the European Union. But in Australia, privacy for the individual is paramount. And one of the key insights as well is that people in Australia, particularly in residential aged care facilities, don't want to feel like they're guinea pigs. They don't want to have to interact with the product. They don't want to have to wear something or remember remember to put something on, whether it be a wearable shirt, watch, headband, any other part of it. So when we were developing products, we were thinking very much about the person that would be using the product, and that was the elderly and the carer. We needed the tool to be nice and simple to use, but at the same time, we wanted to be non-invasive to the person that was being monitored. We wanted to be a safety net and something that they didn't even know was in the room, or at least not at the front of their mind. So if we flick across to the next one, there's a little video that I'll talk through as an explainer. Now, falls are a major concern in a residential aged care facility, in fact, in all parts of healthcare. And for those of you that are in and around the space, you will know exactly what I'm talking about. We're increasing the number of our elderly, yet we're actually seeing a decrease in the workforce, or at least a holding of the current levels, and it's not matching with the same growth level of those moving into more assisted living and a higher level of care. Now, we need to use technology to provide support and tools to the carer so that they can better utilize their time. This is what we're here to talk about. Now, when I mention non-invasive, we do it off the surface of a mattress using sensors. These are then sent via a harness to a comms module and a PCB, which shoots that data off to the cloud. We are monitoring position, presence, or the presence of a person, the position they're in on the bed, so whether they're on the side, the top, the middle, and what posture they're in. Now, these are some very interesting data insights, and we'll flick across to the next slide, which is the power of REMI's data. So the system itself had to be low cost. The sector in Australia is under massive financial pressure. So when we built this system, we knew that if we started with a very expensive product using expensive materials, whilst it would be a technically perfect solution, it wouldn't be adopted. So knowing the sector well, we knew the price parameters of what they paid for a bed now, and we needed to develop within that framework. So the actual system of REMI itself is a low cost when it comes to manufacturing the sensors, the system of sensors. And Samit will talk about that in a minute, because that was one of the biggest challenges our research partners had to overcome, and that was working within very strict price parameters. But it's the data where we see the real power. So once we had stability of platform and data extraction, it's then what we do with that data. We are monitoring every bed in a facility through the course of every night and polling data regularly. Position, posture, presence. We're also getting, in the lab, we haven't proven it in the field just yet, relatively reliable respiratory and heart rate data. The long-term ambition is to be able to deliver algorithms that predict falls. So right now, we are about efficiency of use of time to monitor all people at all times through the course of a night. So a carer, if they're having to intervene with someone having an incident, an accident in one room, they know that the rest of the facility is being monitored by technology. And again, one of the barriers to entry here was not adding extra layers to the workflow, knowing what carers do now and making sure that we fit in with their world rather than making them try and fit in with our world. So the data is the power in this, but the challenge actually goes to how did we develop this technology? And that's probably the best time to bring in Samit, because I do refer to our research partners at RMIT University as the rock stars of research. And one of the critical elements for me as an innovator, as me as a technology provider, was to have a partner in research that understood price parameters, understood commercial realities, and were willing to be flexible in their approach. And that's probably the best time to hand over to Samit.
Thank you, Cam, and thanks everyone for joining today. So Cam has set the scene regarding why SleepTight exists and what sort of technologies they're looking at. I am going to talk more about the crux of the technology that underpins the REMI system. So essentially what we have here is a sensor that can detect pressure. Now, it's easier said than done when you have to put that under a mattress cover, which cannot be felt by the end user, which is the elderly in our aged care homes in this case. So the challenge from the very beginning was not how we can just straight away implement the technology that we have in the lab and find a quick fix solution for what SleepTight was after, but it was that relationship where we talked not only to SleepTight, but also the manufacturers in coming up with a design that reflected the understanding of the market. So we wanted to, one, make sure, obviously, this is something that can be uptaken on a larger scale. it should be user-friendly. So it comes from two places. One, the staff caring for the elderly, and the elderly themselves who will be using the system. As Cam alluded to, the privacy is a major concern in Australia. So this should be something that's not in the front of everyone's mind that's using it. So this system basically relies on an array of sensors that's laminated on the inside of the mattress cover. The subject doesn't feel it at all. We performed some rigorous modeling to ensure that the placement of the sensors is in line with how the body pressure points are. And of course, the data transmission will be then through the wireless platform and the comms platform. I think if I move to the next slide, I can talk a little bit more in depth about the journey of this product. So the work underpinning this technology actually started years ago in our lab, where we essentially made electronics on soft elastomeric platforms, so electronics on silicone or rubber-like platforms. And initially, we were using it for different applications like UV sensors or gas sensors. However, when we spoke with Cam and understood the requirements, we were pretty excited about the vision of Sleep Tight, which Cam alluded to in terms of why Sleep Tight exists. And of course, we wanted to be a part of something that can transform lives, not only to improve the quality of life, but make lives better from the very start when people come into an aged care home. And also give peace of mind to family members who want the best care. So our technology that was at a micro or a nano scale, and I'm talking about scales, obviously, who are familiar with that, thousands of times thinner than the width of a human hair. And that's the scale that we were working at in the lab. And here comes Cam, with this requirement of integrating sensors into king-size mattresses. And that's just a leap of thought for us in terms of how we imagined, something that's really small, and how would we translate it to something that's the size of a king-size mattress. And that's where the relationship with the manufacturers also played a huge role. So we did not sit in the lab and worked in a silo. We spoke with Sleep Tight. We spoke directly to the manufacturers from the very beginning to understand what is it that they need from a mass manufacturing point of view. And that made us iterate our designs over and over again, not just only from a cost perspective and the materials that we use, but also things such as placement. How do we integrate that into covers in mattresses, and then eventually how do we draw data out of it? So the fundamental relationship underpinning the success of REMI is this ecosystem between the researchers, that's us at RMIT, Sleep Tight, which is obviously this major stakeholder here in terms of taking this to market, and importantly, the manufacturers who are going to do the hard yards in terms of scaling the production up so that we can meet demand eventually. So this is something I really want to stress upon. This is a kind of symbiotic relationship that does not often exist in academia, and this is something we should be looking at from the very start. We as researchers often tend to come up with great breakthroughs and present that as solutions to industry. But it's always really good to use your solutions as capabilities, listen to the industry's problems, and use that expertise to actually mold those breakthroughs into products that can be useful for the end user. So this journey of REMI has been a really exciting one for us, and we look forward to where it takes us next. Obviously, aged care is the first target, but the possibilities are immense. And as Cam would tell you, he is contacted by stakeholders from all sorts of industries on a daily basis. So I think with that, I will end our presentation. Thank you for listening in, and over to you, Karen.
Thanks, Samir, and thanks, Cam. And it's some really interesting points. So what we're going to do now that we've heard these two different innovations is we're going to go into breakout rooms, and we're going to look at what are the skills that are needed to be able to use or manage these innovations. Now we have 3 breakout rooms. The first room is going to look at that innovation and they're going to look at the Rehab DK innovation from the view of a citizen or a consumer or a carer. The second breakout room is going to look again at Rehab DK, but this time it's going to look at the use of the innovation from a health provider. So someone that's a frontline clinical or care worker. So how would they use that innovation? And the third breakout room is going to look at the sleep tight innovation. And they're going to look at this from the view of a specialized digital health worker. So this is someone who is working in a role that might provide technical support or information or data support to be able to support the delivery of care. We will randomly allocate you into the breakout room. You unfortunately cannot move shift rooms, but please be assured that we will be sharing the results from all 3 rooms afterwards, and we will be holding future sessions which will look at we'll focus just on one of those cohorts. So our next session will focus on just citizens and consumers and carers. You will be automatically moved rooms, and when you get into the room, we'll be using an innovative online board where you'll be able to share, you'll be able to answer 4 questions that we're going to work through. So when you get into the room, the link for that online board will be shared in the room. And we'll be in the room for around about 15 minutes, being able to discuss these 4 questions before we come back back into this main room again. If you've got any questions, you'll be able to ask that to your facilitator. When you get into that room, please turn your cameras on, your microphones on, and you can use the chat box in that room as well.
Okay. Just wait for people to come back in.
That was quick. No warning.
No.
Sorry, I don't know what happened there. Was that my computer? Was that my problem? Oh, someone's taken us
No,
out
they
of the
just
break
brought
room.
us.
Yep.
Yeah, we've gone back in.
We're back in the main room again.
Yeah.
It was just getting interesting too.
Caroline, are you happy to? I can't see Caroline.
I'm here.
Okay.
Thank you. Yeah, I mean, we discussed a little bit. I think it was hard to kind of get our heads around what are the actual skills that the citizens need in order to be able to use Rehab DK. But one thing is just being able to use a regular mobile phone or smartphone. So that's some of what they need in order to be able to use it. So very basic mobile phone skills.
Yeah, thanks very much everyone for participating in those breakout rooms. It was a very short amount of time, but as I mentioned before we went in, we're now going to do some future sessions where we focus on just particular cohorts, and Andy's going to talk about those in a moment. What we're also going to do with all the information you've put on those Padlet sites, plus we had scribes in each room taking lots of notes, we're going to summarize all of that, Caroline and myself, with the rest of the team, and we will make sure that we send that to everyone that registered for this event. And we hope to get that to you in the next next month, get that to you. So before I do hand over to Andy for his final words, I would like to just, on behalf of Caroline and myself, just like to thank all the people that tonight have been working very, very tirelessly behind the scenes to be able to assist us in bringing this event to you and making everything happen. So Andy B, as well as Susan, Katrine, Michelle, Heather, Andy P, Anthony and Carolina. I'd also like to thank our speakers tonight, Randy, Christopher, Cam and Samit. And I'd also like to thank each of you for your participation tonight, for joining us in this session and beginning the conversation, which is now going to continue as part of the Skills for Health thematic ecosystem for the ECH Alliance. Caroline, is there anything you would like to add?
No, I think that's about it.
Wonderful. Over to you, Andy.
Well, I think probably for one of the first times now, we've actually got back into doing decent workshops within one of our thematic innovation ecosystems. And I'd like to thank again, obviously, Karen, Susan, Carolyn and Heather in the background, and Michelle, and all those people who've spoke today. What we've done today, I think, is done exactly what I wanted to do at the start of the session, which is talk about what the needs are. And we've seen some brilliant information from Denmark. So thanks for that. And then some of the solutions as well. And I think what we've actually then done is done that collaborative bit that we're supposed to be doing in the face-to-face. And wasn't it nice to see groups of people in the same room together, for all those people who've missed that experience over the last few months. But we're going to kick off a range of these now. These are permanent ecosystems. The next one, as you can see in front of you, probably better than I can because I've not got my glasses on, is going to be on the 17th of November. And we're going to focus and do a deep dive on the area of citizens and carers. So we're not going to look at digital health workforce or stuff, but specifically on citizens and carers. But I want to leave you with this thought. We've looked at today some of those options, and I think we've got some fantastic takeaways from Randy from Denmark, and some brilliant innovation examples from both Australia and Denmark for us to take away. I think hopefully the other thing we've been able to do today with these breakout rooms is actually get and meet some people. We've had people from Tanzania and Croatia. We've had colleagues from Scotland and other ecosystems, which is fantastic. I'd invite you to also join the rest of our thematic ecosystems that we run. You can see our website for details. I'm not here to do some adverts. I would like to say thank you very much for all the people who've taken the time to come along at different times of the day, because this is a truly global ecosystem. That's it from me. Thank you very much. And I'll see you next time on the 17th of November.